Do you run a medical practice? Do you own a medical practice? Are you an office manager or a practice manager at a medical practice? Or perhaps you are a physician provider at a medical practice. You should be concerned about the security of personally identifiable health information at your practice, also referred to as PHI. The Department of Health and Human Services has levied stiff fines against hospitals and other types of covered entities with regards to data breaches, both reported and unreported, with regard to personally identifiable health information. I'd like to draw your attention here to Jackson Health, who reportedly paid $2.15 million as a penalty for multiple HIPAA violations. Now, OCR Director Roger Severino reported that their HIPAA program was in disarray. Is your HIPAA compliance program in disarray? Do you feel that you are ready for an audit of your technology assets, of your file systems, of your databases? Should that occur at this time? And do you feel confident that if an audit did happen, you would not be in the same situation as Jackson Health? What about skilled nursing? So in skilled nursing news, skilled nursing data breach with $14 million ransom illustrates industry cybersecurity problems. Now, in this instance, you might be told by your IT services provider to pay the ransom. In fact, if we go down here, we can see that Wisconsin-based PerkSoft reportedly paid the ransom on behalf of their client. However, paying the ransom does not guarantee that you will get access to your files back, nor does it guarantee that you will not be subject to further data breaches. As you can suspect, criminals are not generally honorable when it comes to deals that they make with victims. In fact, by being a victim and by identifying yourself as a paying victim, you may actually self-identify as a repeat target. So if your IT provider's answer is to just pay the ransom, then you can usually safely assume that they have not adequately protected your data. What do we mean by that? There are always new viruses. There are always new pieces of code that are created that have not been seen by antivirus software before. So one can never assume that your antivirus software is going to keep you universally protected in the event of a data breach or in the event of an attempted infection. That is where your managed services provider comes in. That is where your IT solutions provider comes in that is responsible for protecting your practice. If you are having backups done, especially if you are having quote-unquote cloud backups done, then your IT services provider should be able to demonstrate to you exactly how the backup repository is protected from ransomware infection or from encryption from the source machine. If your provider cannot explain to you in terms that you can understand exactly how your data is protected, exactly how personally identifiable health information is protected, then you may not be adequately protected. And you should probably assume that you are not. And don't assume that these problems only affect the practice. As we can see here, Mercy Health in Muskegon, Michigan, fired a nurse and other employees per this story for simply viewing health information, personally identifiable health information, that they were not authorized to access as part of their jobs. Now, you can assume that Mercy Health took this action, perhaps in part, to protect themselves from fines. And this does not necessarily guarantee that they will not be fined by the Department of Health and Human Services. However, terminating those employees may have placated the right people at the Department of Health and Human Services so that they can avoid an audit, or so that if they are audited, the audit will not reflect this data breach. If you manage a healthcare practice, if your livelihood is dependent upon a healthcare practice, do not let what happened to this nurse happen to you. Not because you would, of course, view records that you're not authorized to view, but don't let this happen to you through inaction. If you're responsible for vetting your IT services provider's measures, if you're responsible for choosing the IT service provider, if you're responsible, or if you were the one who signed the contract for cloud backup services or offsite backup services, then you could find yourself in this position should a data breach occur, and should the measures that were taken fail to protect the security of personally identifiable health information within your practice. What would you do if you lost access to all patient records? Electronic patient records. Would you go back to paper? Would you spend months scanning charts? Avoid this by working with a provider such as AmeriHub Technologies, which has years of experience in protecting healthcare practices from ransomware, which has years of experience in secure offsite backup solutions and other measures to protect against ransomware, including frontline antivirus that tends to function better than what you buy at the store. If you are not sure that you are protected adequately from ransomware, and you are in a principal position at a healthcare practice, then I encourage you to contact AmeriHub Technologies by emailing help@amerihub.com for a free quote on how we can protect your most vital assets, your patients and their records.